हम अभी हिम्स मेरठ में मौजूद हैं और क्योंकि डॉक्टर बीआरसी के प्रोटोकॉल सिर्फ भारत ही नहीं भारत के बाहर भी देखे जाते हैं कि जो मरीज़ हैं वो भारत के बाहर तक इन प्रोटोकॉल्स का फॉलो करते हैं। अभी तक आपने वियतनाम नाम जो है कई बार सुना होगा, वियतनाम, इंडोनेशिया, मलेशिया, ये सभी नाम जो हैं अक्सर आप सुनते होंगे। लेकिन आज जिन्हें हम आपसे इंट्रोड्यूस करने जा रहे हैं वो शख्सियत जो है वो सीसीएपी कोर्स भी कर चुकी हैं और यहाँ पर इंडिया में पिछले 2 बार से आ चुकी हैं। डॉक्टर बीआरसी के प्रोटोकॉल्स लगातार वो सीख रही हैं और अपने मरीज़ों तक भी पहुँचा रही हैं। मेरे साथ मौजूद होंगी उताना। अब सही नाम जो होगा वो हम जानते हैं। वेलकम फर्स्ट ऑफ ऑल।
Welcome here at Meerut.
Can you introduce yourself first of all?
My name is Uta Hanna Dehnert. I am a citizen from Germany and I'm a resident in Singapore.
Okay. So, what is the purpose to come here?
I have my own clinic, Therapeutic House in Singapore, and I run it since many years. And a few years ago, Dr. Biswarup made a visit in Singapore and introduced his concept and his protocols in Singapore. So I attend my first 72-hour class a year later, just before COVID. So and this is how we get in contact.
Very nice. So, what is the most important thing you liked about Dr. BRC's protocol?
It's very integrative. He touches a lot of areas of our life. So it's about food, that we have the DIP diet, then we have sun, like just now, as light as therapy. He has different kinds of therapies combined into a whole concept. And this is very interesting and amazing, yes.
What have you learned yet?
Also here is that the DIP diet is not only a single diet, they diverse it now to special conditions. This is a bit more new for me. So then the Panchkarma, heat as therapy, supports for sure the hot water immersion. And I learned this weekend that we have even different kinds of hot water immersion. More than only 1 or 2. So, depending on the client's condition, you can vary it.
Okay. So, you also are the student of Dr. BRC?
Yes, I attend the HELP and the CCAP, also Circadian Clock and Ayurvedic Panchkarma class.
Okay. So, what is your experience in the whole classes and when you met with the patients?
Yeah, I had the hand-on training in Jalandhar. So, and we were 7 days there with my fellow students, and we learned how to practice and how to apply the different therapies on the body, and when we have to use it and which one we have to use.
So you said you are the residents of Switzerland, I think. Oh, I'm really sorry. You're the residents of Singapore. So, what is the difference between Singapore's hospitals and here in India?
Although I attend now 3 of the HIMSS hospitals and I visited them. So, and I like the holistic approach that you have homeopathic, you have naturopathic, you have Panchkarma and Ayurvedic approach. But this is something what is amazing, that you even include allopathy, because sometimes we need it. It's not that it's a devil. Also we need it for special treatments or for special conditions. We can combine everything. So, and here you are not afraid of the other side. Allopathy works with integrated medicine, with Panchkarma and with holistic medicine, and opposite as well. And I like that this is like a friendship between 2 different possibilities.
Right, true. Uthana, there is one more thing. Our world is developing. We have a lot of medicines. We have a lot of great investors or inventors. I'm really sorry, or doctors. And on the other hand, we have nature. We have soil. We have everything. What you can watch here. So, what do you think about different pathies and this pathy?
For me, I like the phrase from Dr. Biswarup that he said, no money, no medicine, no mortality. So, and this includes that a lot of the things he teach and he educate patients, that they come from nature, or that they can practice the therapies at home actually. So they get trained and they can use it, and they don't have to pay a lot of money. They do not have to go to hospitals to do it. So, and I like at HIMSS that you can get an introduction. You can stay here for a couple of days, or if you even want for 1, 2, 3 weeks, to get to know how it works, to get trained, and then you can go on at home. But when you don't have the money to do it, you still has some contact with the doctors from Dr. BRC's team, so that you can do it actually at home as well.
So, have you ever interacted with the patients here?
Yes, this is always, I like to eat in the same room like the patients, so that I have the possibility to talk to them. So, and I get to know, for example, that one diabetes 1 client, and she's now 72 hours here, don't need insulin. Her blood sugar came down by applying the DIP diet and some other therapies which were supposed for her to do. And I'm amazed, yeah, so that she feel great and do not take in the moment any insulin. Yeah, or I had some kidney clients, they really feel better, and the urine output is different now between day and night, what was more problematic before, and they feel great as well. And when they continue the next weeks, I think they will have good results.
Right. Okay. Would you like to open another clinic in Singapore?
Also Singapore, we must see how we can implement it, because the regulations are a little bit different like here. But I found a very nice Ayurvedic lady, a clinic, and I started now to cooperate with her, so that I can send the clients according to what I want her to do. So I give her the therapies, so, and then she can apply it. When she has other ideas, she can communicate with me and said if we can do something else. So because in the moment some things I cannot do in my clinic, but there are other
Suggest to the other hospitals. Oh, sure. Thank you so much, Nana. Thank you for
welcome.
तो ये थी पूरी चर्चा। और अगर आपके मन में कोई सवाल हो इस पूरे कोर्स को लेकर और तमाम चीज़ों को लेकर, तो वो आप हमसे पूछ सकते हैं।
अगर आप डॉक्टर बीआरसी क्लिनिक या फिर डॉक्टर बीआरसी हॉस्पिटल खोलना चाहते हैं, या फिर अपने एग्जिस्टिंग क्लिनिक या हॉस्पिटल को अपग्रेड करना चाहते हैं विद डॉक्टर बीआरसी प्रोटोकॉल, तो स्क्रीन पे दिए हुए लिंक में जाके फॉर्म भरें।